Earlier this year, the Care Quality Commission, the CQC, conducted a routine inspection of the Isle of Wight NHS Trust. The inspection report highlighted a number of failings in the way we deliver care, and as a result, the Trust was placed in special measures. Since then, the Trust has been working hard to understand the root causes of the failings identified by the CQC. Led by its new interim chief executive, Maggie Oldham, the Trust has been developing a single, all-embracing programme that brings together the changes the Trust needs to make if it's to deliver the sort of care that communities on the Isle of Wight expect and deserve.
We've got things wrong in some of our areas, and now's the time to put them right, and we've got some real urgency about putting them right, because nobody likes being in a situation that suggests that we're not providing the very best care that we can for our patients. One of the things that's been really pleasing for me is I haven't yet met anyone that said to me it can't be done or it shouldn't be done. So everywhere I've gone, and I've tried really hard in the last 10 weeks to meet as many staff as I can, and I've also spoke to a lot of our patients and users. Everybody is united in the fact that we want to improve.
Previously, the Trust had a large number of single-issue action plans, but no overarching framework to drive the delivery of improvements. The Trust leadership has now created a single integrated improvement framework, the IIF, that captures all our improvement activity into a single programme. The overall aim of the IIF is to develop a sense of continuous improvement at all levels and in all parts of the Trust. The key themes cut across all of our clinical business units and right across acute services, ambulance services, mental health services and community services. The IIF is a detailed document, but what it means in practical terms for Trust staff can be summarised very simply.
If every member of staff treats every patient they deal with like they would like themselves or their family members to be treated, we'll deliver the IIF. This is for me about putting patients at the centre of what we do. Now, people will say, oh, that's just rhetoric, but it isn't. This is about making sure that the call bells are in reach of our patients, that patients get weighed on admission, that pre-assessment checklists are completed adequately, that discharge checklists are undertaken properly, that patients are given an expected date of discharge when they're admitted. It's the things that people should be doing that perhaps sometimes we lose sight of. If everybody did what they know is in their job and their role, and they do it to the best of their abilities, then they'll contribute to us getting out of special measures.
Progress is already being made. We're recruiting more staff and reducing our reliance on agency staff. We've set aside £1 million for improvements to buildings used by mental health services in order to make them safe, and work has already begun. And we're putting in place new arrangements designed to prevent patients from having multiple bed moves. The Trust leadership is confident that if it works closely with staff in all parts of the Trust, we will be able to deliver a better outcome when we are next inspected by the Care Quality Commission.
I think for me it's simple. I ask every member of staff to always put patients at the centre of what they do. And if they do that, then we will go a great way to delivering what we need to do with our improvements. And it's, if you see something wrong, well, put it right. If you walk past a crisp packet on the floor, pick it up and put it in the bin. If you walk past a lost patient or a relative, stop and ask them, are they okay? So really it's...
Can I help?
Can I help you, yeah. And I know a lot of our staff do that, but I want people to realise those are the simple things that will get us out of the predicament we find ourselves in. So it's put patients at the centre of what you do your job to the best of your abilities, and if you see something that's not right, well, don't think somebody else will put it right. Take the time to put it right there and then, or report it immediately so somebody else can.
The Trust Board has set the ambitious target of achieving a CQC rating of good by 2020, which is why we've called the IIF Staff Engagement Programme Getting to Good. Over the coming weeks, we'll be establishing a dedicated staff engagement website giving updates, news, improvement case studies and so on. We'll be developing a regular electronic newsletter that showcases our very best improvement stories. And we'll be establishing a staff engagement advisory group to help ensure we use the most effective communication channels and undertake engagement activities that are sensible and suitable. We have a lot of work to do, and the Trust faces some very big challenges. Some involve the board and the executive leadership. Some involve our middle managers and our frontline staff. None of them can be tackled successfully unless we work together as a team. We can turn this trust around. We can transform services for the communities that live and work on the Isle of Wight. And over the course of the next few months, we will.